Deficiency of which of the following enzymes is most likely responsible for this infant's condition? Okay, so this looks like a lysosomal storage disease. 7-month-old infant with developmental regression and muscle weakness. Parents report that they've been a normal development until recently. An examination has exaggerated startle response and cherry red spots in the retina. All right. So there's usually only two with the cherry red spots. Enzyme, a deficiency in the following enzymes. Okay. Um, the cherry red spot, I think of Tay-Sachs and I think it's Hurler. Hurler's on here. Tay-Sachs is also on here. Let's see. Normal development. Exaggerated startle response. Cherry red spots in the retina. Hmm. I was trying to think. Developmental regression, muscle weakness. It's not cluing me in to anything. Star response, like none of those words besides a cherry red spot is um stimulating anything. I would just go with because they test it more, I would just go with Tay-Sachs, and that's the
Okay.
hexo. So that's the A, but with my
Yeah.
backup being the last answer, which is Hurler. I'm pretty
Okay.
sure Hurler has a red spot as well.
Yeah, I mean, the highest yield thing with the red spot is usually Tay-Sachs, like you
Okay.
said. Peroxidimidase. Let's talk about this one. Is associated with hurlers, autosomal recessive, but they have coarse facial
Course
feature,
vision
corneal
region.
clouding, hepatocellular. But it seems like they don't
Oh,
test
that's
for
not the one. There's another one with a cherry red spot that I usually.
Is it Neiman Pick? That's what you're thinking
It
about.
might be. Yeah, it might be. Although
Neiman
isn't
Pick.
Niemann-Pick what you Niemann-Pick is without the red spot, but it does have the hepatosplenomegaly stuff. Let me see.
Yeah, it's kind of confusing because I looked this up a while ago. I think in first aid, if I'm not mistaken, you might have to look for me. They say that I think Neiman Pick might not have the red spot, but just check for me. But
Yeah, I
I
have
do.
it open. Yeah. Okay.
Does it say in there that it has it in the book?
In first aid, yes. So Niemann-Pick it says has it,
Oh, okay, okay, perfect, perfect.
and also so does Tay-Sachs.
Yeah, so they both have it, and like you said, the hepatosplenomegaly, but they're saying the difference here is going to be the exaggerated startle response is more likely Tay-Sachs. So
That makes sense. Okay, so Hurler, I was thinking it doesn't have the red spot, but it's the other one with it's corneal clouding or something. That's how I remember like
yeah.
Hurler. But then also they're more of like I remember the pictures of the kids. They're like more, I remember them as like more like coarse facial features makes more sense. Okay.
Perfect.